So what we're going to talk about today is informed medical decision making. And the reason why informed medical decision making is important, actually a couple of reasons. First of all, because most people are not making informed decisions. And the second thing is because if we use informed medical decision making as a way to approach people about health issues, it leads to the decision to make diet and lifestyle changes. How many of you have approached somebody and said, I'd like to talk to you about your diet, or you're getting sicker? Have you ever thought about diet being used as an intervention tool, and they're not interested? Anybody had that experience? Okay. Well, I want to make you, first of all, know that it's not you, it's them. I was unable to convince my own mother that she should change her diet. She died 4 years ago, and she died of what I think are foodborne illnesses. Then she was over-medicated, over-treated, too many procedures, would not listen to what I had to say. So you've probably heard this before. It's hard to be a prophet in your own land. I can't be a prophet in my own land sometimes either. I have to fly to Orlando, Florida, and find people to talk to, all right? Because some of the people in Columbus don't want to listen to me. But the point is that many times if we talk to people about healthcare in a broader picture, and we let them see how ineffective some healthcare is, they become surprisingly interested in changing their diet and lifestyle habits. And so we're going to talk about how to achieve better health outcomes with informed medical decision making, and how approaching people in this way can actually lead them to maybe be more receptive about listening to you about other things. Okay, so this is our mission statement at Wellness Farm Health. We believe it's a fundamental right of all consumers to have a complete analysis of the risks and benefits of any test, drug, supplement, procedure, or medical practice of any type before making a decision to proceed. How many of you agree with that? Okay, now having said, everybody raises their hand, how many of you regularly, before you made this conversion to a healthy diet, or even now, have conversations with your doctor that go something like this? Your doctor says, I'm a little bit concerned about some of your biomarkers. Now we have a couple of choices. I could medicate you, and that would solve the problem really quickly, but I want to really make sure you understand the risks associated with these medications, and I'm going to give you some information to read. Take it home, review it with your family, and come back next Wednesday and tell me what your decision is. How many of you have those kinds of discussions? One person in the room, right? Most people, what happens is a doctor says, take this drug. The patient says, okay. You find out later on that maybe that wasn't such a good idea. So we have to do this differently. You know, the worst thing I hear in my office every day is, if I had known then what I know now, I never would have, and you can fill in the blank, whatever that decision would have been. All right, so medicine today, and I think all of you would agree, if we take a look at what's going on in healthcare, it's expensive, it's impersonal, it's not very collaborative, it's not evidence-based. I'll prove that to you by the time we're finished here. A lot of diagnostic tests, drugs, and surgeries, the benefits are exaggerated, the risks aren't talked about enough. Consumers are unhappy. I have news for you, health professionals hate it too. My colleagues who work in hospitals and medical institutions wish that they were architects and plumbers and roofers and something else, anything but what they're doing now. And there's no question that the system is ripe for upheaval. It really does have to change when things get to this place where everybody's unhappy. The bad news is everybody's unhappy. The good news is it really is ripe for change. So what is informed medical decision making? Let's make sure we're clear on what the end point is here. The patient's given objective information about health conditions and what causes them, develops a clear understanding of the risks and benefits of any option that's put forth, has the freedom to choose the best option based on the patient's value system, not the doctor's. And what basically we're trying to do is change the concept of informed consent. So what informed consent means right now is the doctor says, do this, we call that informing, and the patient says, okay, and we call that consenting. All right. The better way to do this would be for a doctor to put forth a group of a repertoire of choices along with risks and benefits, and then the patient really has options to choose from and informs the doctor of what the decision is and how things are going to go from here. Now, some people disagree with many things I have to say. Some people have even called me controversial. Okay, and my answer to that is I'm wondering when telling the truth became controversial. It seems to have become a very controversial thing. But with that in mind, and also keeping in mind that the objective is informed decision making, taking control of your health isn't doing what I say instead of what somebody else told you. All right, and that's so often what happens. People give their lives and their health over to other people to make decisions for them. Taking control of your health is doing what you want to do based on your understanding of the options. So if you disagree with something that I say here today, that's fine, because it's the decisions that you make about your body are very personal to you, and I don't really have a horse in the race. So this is not about doing what I say.